insurance. Some of you may have even spoken with me this open enrollment in regards to finding your plan. Also joining me today is Mullick. He is our product manager, and he will be speaking as well. Topics for today, we are going to be covering benefits to CBA members, as well as the breakdown of network options available to you, this OEP, other options such as supplemental insurance, and deadlines, since they are coming up soon here.
So just to start off, I wanted to talk briefly about IX Solutions and who we are. Many of you have already had a chance to speak to us, so I'll make this very short. We specialize in small to mid-sized businesses along with individual and Medicare health insurance. We've been in the industry for over 28 years, and through the 28 years we've seen many changes and have been able to help members and clients through all the changes and make sure to get the health plan that they need and truly deserve. We cover anything from group individual health insurance to compliance, consumer-driven accounts such as HSA, FSAs, and overall our goal is to educate members and bring clarity in this highly regulated, ever-changing insurance marketplace. Speaking of changes, I'm going to hand it to Grace, who's going to talk briefly about the local market updates. And again, we know we've mentioned this in our prior webinars, but wanted to briefly touch on this again.
So as you know, there's been many changes to the landscape of the individual market. Some carriers, like United Healthcare, have entirely left the individual marketplace, and some have even gone out of business, like Land of Lincoln. That's why this open enrollment period, we are only offering Blue Cross Blue Shield. Not only is it the only carrier offering a PPO option, this OEP, but it's been the most stable in the individual market, and we put our trust in them. So now I'm going to go through some of the Blue Cross networks available this open enrollment. There are 4 network options. First, the Blue Precision HMO. This is the only plan giving access to the North Shore Hospital System as well as Northwestern Medicine. Second, Blue Care Direct. It's an open access HMO. Open access meaning it's still an HMO, so you do have to designate a primary care physician, but then you have open access to advocate facilities. You do not need a referral to visit specialists within advocate as long as you remain within advocate facilities. Third is the Blue Focus Care plan, also an HMO. It's a new network, and it only covers hospitals in Cook County, but it is the most cost-effective plan. And lastly, Blue Choice Preferred PPO. It's the only PPO option in the marketplace in 2017 for individuals, and is different than the group PPO. It is a narrow network PPO, so it does not include hospitals like Northwestern, but it does give you those out-of-state in-network benefits. Say if you were to have an emergency and need to see a doctor out of state, it would be covered. All right, and some updates on Northwestern. So both Blue Cross and Northwestern have said different things when it comes to specialists and primary care physicians regarding Northwestern. We've been in contact with both, and this is why we recommend you go through us so that we can continue to give you updates on what's going on with Northwestern. Blue Cross Blue Shield has not given us the list of doctors that are going to be participating in the network yet, but if you go through us, we would be able to access your account and allow to make any changes on your behalf, depending on the changes that do occur.
Now, there's a few things I wanted to add on this because this is very important. This is where 90% of our calls that members are asking about. One thing that we can say for sure is that Northwestern and Blue Cross have confirmed that you will get access to Northwestern Hospital through the Blue Precision plan. You do have to pick the medical group 475. What we do not have confirmed is what are the doctors, that are the primary care physicians that you have to pick. We don't have that list yet. That list should be available in January, according to Northwestern. As soon as we hear more, we will communicate to everyone. But the goal is for everyone to enroll by December 15th so you can get access. You can be insured. And if there's any changes that happen, we can always make it in January. So again, if you want Northwestern, go with Blue Precision. You're going to enter the medical group number 475, which we'll help you with, and you can leave the primary care physician as blank. And making sure doing that option will allow you to continue to update the physician's list later and making sure the whole process is smooth. The other things that we do not have confirmed is so Northwestern is claiming that you can go to any specialist without any referrals, where Blue Cross is saying, no, you will need a referral from your physician. So again, those are the two conflicting information that we will have to see how it goes once January comes around. Okay, I'm going to go to the next slide. And here I will now explain a little bit about health insurance in the individual market when it comes to on-exchange and off-exchange. So on-exchange, the biggest difference is one of these exchanges, which is on-exchange, is subsidy-eligible plan. So any health insurance plan that you can get a subsidy from. Actually, just give me one moment, and I got to confirm something on that one. Yep, actually, sorry. So yeah, on-exchange is all subsidy-eligible plans, where off-exchange is where you get access to more plans, but they're not eligible for subsidy. They both are Obamacare plans, the Affordable Care plans. They're all compliant. So you can shop through on-exchange and off-exchange through our platform. Individual shared responsibility. Now, this is basically saying this is the employer mandate that ensures that you're paying a penalty or you're not paying a penalty. So for 2017, if you go with an Affordable Care plan, if you go with an on-exchange or an off-exchange plan, you won't have to pay these penalties. However, if you don't go with the plan, the penalty is $695 per adult, $695, or $347.50 per child under the age of 18. And the maximum is $2,085. Or it's 2.5% of your household income up to $2,580 per family member. And out of these two, it's whichever one is the greater amount. That is the one that's going to be charged. And you will pay for these fees when you're filing your taxes. And next, I'll cover supplemental insurance plans. And these are basically plans that are either complementing your health insurance plan or a supplement, such as a short-term plan in case for those who don't want to go with a health insurance plan. And I will talk about short-term health insurance plan quickly. Short-term plan covers up to 11 months of coverage, and this is for individuals who say, I don't want to go with individual health insurance plan because it's too expensive or it doesn't have the doctors or hospitals I need. And by all means, we do not recommend anyone not to go with a health insurance plan, but in case you do not, we always recommend to keep yourself protected, you and your family. Short-term health insurance plans are the way to go. They do not cover pre-existing conditions. That is something to keep in mind. So if you are currently being treated for something and you want to continue getting treatment for it, short-term plan option is not the answer for you. If you're a healthy individual that feels that you don't want to pay those prices and you would like to make sure you're still covered in case something happens, that is the option for you. Now, this 11 months of coverage, or 11 to 12 months of coverage, will only last if you get a short-term policy in December. In January, it will go up down to 10 months. February, it will go down to 9 months. And it will continue to go down to 3 months. That is a new law that has been passed, that in 2017, short-term plans will go down to 3 months per policy period, and you would have to keep renewing it. So again, very important to, if you were looking for short-term health insurance, to get it in December so you can get the full year of coverage. Another advantage of a short-term plan is that it does have the large network through United Healthcare. United Healthcare has the largest network available nationwide, and this short-term health insurance plan would have that. So in case something comes up and you need to see Northwestern, North Shore, Loyola, any of those facilities, you can do that. And the best part is it's half the price of individual health insurance plans. But again, these plans are not compliant with Affordable Care Act, and therefore you will have to pay a penalty if you don't go with an individual health insurance plan. Critical illness. Now, this is something you would want to supplement if you go with a individual health insurance plan. Normally, someone was to pick this plan, it would be because you went with a high deductible plan, you're fairly healthy, but in case something comes up, you do not want to pay the $5,000, $6,000 deductibles or these out-of-pocket maxes. So the best way to do that is to protect yourself through a critical illness plan, where you can go whichever doctor you want. As long as any of those conditions happen, something critical illness happens, they pay you cash benefit for that occurrence. So you don't have to worry about which doctor to go see. Accidental plan. Now, accidental plan is a little different, where critical illness pays you cash as soon as the occurrence happens. Accidental plan will still pay cash, but it will pay your out-of-pocket expenses. So once you go see a doctor, if you get hospitalized and there's some out-of-pocket expenses for you, they will try to cover your deductible plans for it. So this is also another great plan to have for hospitalization or anything that an injury occurs. So again, both of these plans are less than 10% of an individual health insurance policy. And if you're going with the high deductible plan, I always recommend to complement it or add it with an accidental or a critical illness plan. Now I'm going to hand it over to Grace, who's going to talk a little bit more about the benefits of continuing to work with the Chicago Bar Association's Benefit Center. And Grace?
So as Moloch mentioned, one of the biggest benefits is education through us, especially with all these changes going on with Northwestern. Working through us, we will continue to give you updates on any news that we hear in the insurance industry, as well as our portal that we provide you to compare and enroll all in one place. We give you guidance and support pre and post enrollment, so we're here for you throughout the entire year. And also with your enrollment, you will have a free subscription to Health Advocate. Let me explain more about Health Advocate. So Health Advocate, think of this as your personal assistant for your health insurance. It's available 24 hours a day. It is a nurse's line. So we're here to help you with questions about ID cards and the breakdown of your coverage, but Health Advocate can help you finding the right doctors, explaining test results and things of that nature at any point in the day. This is covered by CBA and I Solutions, so it's offered to you at no cost. It's included in your enrollment into. Okay, so important dates and deadlines for OEP. Just to touch really quick, as Moloch mentioned, if you're looking for a short-term policy that's going to cover that 11-month time period, that is only available before January 1st. To have a January 1st effective date for your health insurance plan, you want to enroll by December 15th. Now that is coming up shortly here, so feel free to call us in the next few days if you're having trouble enrolling. For a February 1st effective date, that's going to be any time you enroll after the 15th of December before January 15th. And then after that, a March 1st effective date if you enroll anytime after January 15th before the 31st. And the 31st of January is the last day of open enrollment period.
So these dates are very important to understand. As you see, December 15th is the last date for if you want to be insured when January 1st comes around. So again, do not put yourself at risk. If you're unsure of the Northwestern hospital situation or just unsure of anything, we always recommend to pick a health insurance plan. The open enrollment period is going till January 31st, so we can always make changes in January, and we can always put you onto a different plan. But we cannot go back in time and get you a health insurance policy effective this January 1st. So hopefully this all helped, but now we will open it up for just a little bit of Q&A to see if anybody has any questions. I'm going to pause for just 30 seconds to a minute to queue up all the questions.
Okay, so first question I'm seeing is from Ruth Kaufman. How do you choose Group 475? Okay, for Northwestern Access, yes, 475 is the medical group number. If you're filling out a paper application, that's going to be on page 2, medical group hashtag, and all you do is designate that 3-digit code in that box. If you're looking online, you will not see a pop-up to enter that 3-digit code. What you want to do, or we can enter it for you after you've been enrolled. So after I see that your plan is active online, I can enter that for you. Otherwise, after your plan has been active, you can also designate it yourself through your Blue Access for Members account. So it's very easy.
Yeah, or just give us a call too if you want to know how to put 475 on your application. We can just send you an application with that group number already pre-written in it. And just when you submit it back to us, your application, we do look through it to make sure everything is properly filled out. We'll submit it to Blue Cross to make sure everything's going well. So that's one way of doing it. Second question is, where can I look at the option plans with pricing? So there's 2 ways of looking at all the options you have when it comes to your plans and the pricing with it. One is just to go through the CBA Exchange, the website. And in there it says shop individual plans. You enter your information. You can look for pricing from there. And the second option, of course, is to give us a call. So if you go and if you see the number here, you can give us a call at 888-239-4408, and you will speak to one of our benefits specialists who can get a quote ran for you, show you what the plan options are, and even discuss any questions you may have. I'm going to just wait for a few more we have written in there.
Okay, next question. Can you change your primary care physician under the Blue Cross Blue Shield HMO if you do not like the doctor you initially choose? Yes, any of the HMO plans, you can designate a different primary care physician every day if you'd like. Any point in time through your Blue Access for Members account, you can change it, or if you call us having any troubles, we can change that for you. It's very easy, and you can change it as many times as you'd like.
So the next question that I'll paraphrase basically is asking, how do you know what to enter for income if you know the income's going to change drastically from 2016 to 2017? And that's actually a really great question, because when you're entering your income, when you're applying for on-exchange policy, you shouldn't enter your 2016 on what you made last year. You should always do what you project to make in 2017. So I'll just give a perfect example. If last year I made $50,000 in 2016, but in 2017 I plan, for some reason, I'm going to make $10,000 less, $40,000. So what I would do is I would say, okay, in 2017 I'm projected to make $40,000, and if that qualifies me for subsidy, that's great. I can get that. When my tax returns, when I'm filing my taxes for 2017, if my income is above that, I'd have to pay some of the subsidy back. If my income is less than that, then I do have the option of just getting a little bit more credit. I always recommend to enter a little bit higher than what you think, just because you don't want, that's just something your accountant would always recommend, just so they don't want to do a lot of back and forth on that. But again, you would have to go with your projected, and in case anytime you see your income changing, healthcare.gov does ask you to go into that portal or contact them and change your adjustment immediately, so you're not even, shouldn't wait the entire year for it. I'm going to read a few more questions here, and then we'll end it shortly. So the next question is, can we enroll in supplemental insurance with you? Yes, you absolutely can. Give us a call. We will help you find the supplemental insurance you're looking for.
Okay, next question. What happens if I choose medical group number 475 and later learn that my Northwestern doctor is not on the HMO plan? Good question. That's asked quite often. So the good news is, even after January 1st, if that is when the list is released, it's still open enrollment. So we can make changes to your plan if you choose. Maybe that's a deal breaker if your doctor's not in. You can change to another plan before January 31st. You'll just have a later effective date.
One thing I want to add to that, because it could be a twist to this, right? So let's say your doctor is not in the medical group 475, but then what if he's still a Northwestern doctor and he's not in that group number? There's a chance if it's not in any of the individual plans. So that is also something we'd have to consider in January is your doctor may not be participating in any plan that's in the individual marketplace, which brings us to different questions, such as do we need to get supplemental insurance, or do we need to get some different types of plans to make sure you have the coverage. So at this moment, from what we know, if you have a specialist at Northwestern Hospital, you will be covered through the Blue Precision plan. Now, if it's a primary care physician, that may be a different story because that is the one that we're waiting on list for. But if they're a specialist, you will be covered. We're going to wait we still have a few more questions we're going to go through. Okay, so what's the difference between off-exchange and on-exchange? So they both are compliant plans. They both are ACA plans. The only difference is on-exchange is for plans that qualify for subsidy. So if you're looking for government assistance in paying for your plan and you qualify for it, you would want to shop on-exchange. If not, you always want to shop off-exchange. The reason being is because off-exchange there's more plan options available. Everything you see in the individual marketplace, they're either into off or on exchange. And what off exchange does, it has plans that are included already in the on exchange, plus more. So if you were to look at it, it's just a larger pool of plans, and you may find better, cheaper options on off exchange. Hope that makes sense. If not, definitely give us a call.
Okay, looks like that's all the questions that we have for today. Just would like to say thank you for attending again, and if you do have questions that weren't answered in this webinar, please give us a call. Our contact information is on that last slide there. We'd be happy to help you.
Have a good day, everyone.